Hello friends, welcome back to Mlt question 1. Today we are going to discuss another question paper. Dipotassium salts of EDTA is recommended in CBC because it is option A more water soluble, option B more water solvent, option C less water soluble, option D less water solvent. Dipotassium salts of EDTA is recommended in CBC because it is more water soluble. Next one, 1 millimeter thickness of buffy coat approximately equal to total leukocyte count of about. That means what is the concentration of total leukocyte count per 1 millimeter thickness of buffy coat? Buffy coat contains leukocytes and platelets. So buffy coat is equal to the normal leukocyte count. It is 5000 to 10,000. Here we have 1000, 5000, 10,000 and 12,000. So the right answer is option C, 10,000. Next one. Method of estimation of hemoglobin from the amount of oxygen it absorbed is option A gasometric, option B cyan hemoglobin method, option C oxyhemoglobin method, option D Salis method. Method of estimation of HB from the amount of oxygen it absorbed. The right answer is option A, gasometric method. Oxygen binding capacity of hemoglobin is measured. Next question. Inclusion bodies seen in RBCs of patients with G6PD deficiency. Inclusion bodies in RBC with G6PD or glucose 6-phosphate dehydrogenase deficiency. Option A Schaffner's granules, option B Heinz bodies, option C Howell-Jolly bodies, option D Pappenheimer bodies. The right answer is option B Heinz bodies. Next one, substitution of valine for glutamic acid in position 6 of the beta globin chain of hemoglobin causes. Option A aplastic anemia, option B leukemia, option C sickle cell anemia, option D thalassemia. Substitution of valine for glutamic acid at position 6 of beta globin chain of HB. It is sickle cell anemia. The right answer is option C, sickle cell anemia. Next one. Test used to measure fructose concentration in semen. Option A Benedict's test, option B Osesson test, option C resorcinol test, option D GOD-POD test or glucose oxidase peroxidase test. The right answer is option C resorcinol test. Fructose concentration in semen is detected with resorcinol test. Next one. In which condition increased urobilinogen is found? Option A hemolytic anemia, option B pernicious anemia, option C malaria, option D all the above. Increase urobilinogen. In which of the following conditions high urobilinogen is seen? We know that in hemolytic anemia, pernicious anemia and in malaria there will be high urobilinogen. So the right answer here is option D, all of the above. Next question, question number 8. Urine preservative which causes a false positive reaction for proteins. Option A thymol, option B formalin, option C boric acid, option D HCl. Which of the following urine preservative causes false positive reaction with protein? The right answer is option A thymol. Thymol will causes false positive reaction for proteins. Next question. Normal adult CSF pressure when the patient is lying in horizontal position. The right answer is option A 100 to 200 millimeter of water. Normal adult CSF pressure when the patient is lying in a horizontal position is 100 to 200 millimeter of water. Next one. For the earliest pregnancy determination, one should use Option A, urine. Option B, serum. Option C, vaginal fluid. Option D, saliva. The right answer is option D, serum. The earliest pregnancy determination is possible with serum. Next one. Name the subgroup of B blood group. Here the right answer is option B, BX type and BM type. The subgroups of B group are BM, BX, B3 and BL. So the right answer is option B, BX and BM. Next question. Monoclonal antibodies to blood groups are derived from option A, hybridoma cell lines, option B, antibioma cell lines, option C, sarcoma cell lines, option D, plasmacytoma cell lines. Monoclonal antibodies are derived from hybridoma cell lines. Next one. In direct agglutination test, which of the following is used to enhance the reactivity of blood grouping and typing antibodies? Option A, bovine serum globulin. Option B, bovine serum albumin. Option C, bovine serum ceruloplasmin. Option D, none of the above. The right answer is option B, bovine serum albumin. Next one, which of the serological tests not performed on blood after collection from donor for blood transfusion? HIV test, hepatitis B virus test for syphilis, test for typhoid. Before transfusion, HIV test, hepatitis B virus test and test for syphilis will be done, but the test for typhoid will not performed before blood collection for donor selection. So the right answer is option D. Next one. The following statements are correct regarding a delayed hemolytic transfusion reaction. Option A, blood film shows spherocytosis. Positive direct antiglobulin test. Unconjugated bilirubin raised. All statements are correct regarding delayed hemolytic transfusion reaction. Option D, all the above. Next one. Saturated formaldehyde solution in water is of dash percentage. Option A 20, option B 30, option C 40, option D 10. The right answer is option C 40. Saturated formaldehyde solution is 40% and it is equal to 100% formalin. Next question. Following are microanatomical fixatives except option A, Zenger's fluid, option B, Boyne's fluid, option C, buffer neutral formalin, option D, Clark's fluid. The right answer is option D, Clark's fluid. It is a cytological fixative. Next question, question number 18. Burst clearing agent used for research purpose. Option A, chloroform, option B, cedarwood oil, option C, xylene, option D, toluene. Burst clearing agent for research purpose. It is cedarwood oil. The right answer is option B, cedarwood oil. Next one. For cutting thin sections of most tissue, temperature of cryostat should be kept at which temperature? The right answer is option A, minus 20 degrees Celsius. Minus 20 to 22 degrees Celsius. Next question. Pearl's Prussian blue reaction is done for the demonstration of option A, reticulin, option B, hemosiderin, option C, connective tissue, option D, glycogen. Pearl's Prussian blue stain is used for hemosiderin. Pearl's Prussian blue is an iron stain and hemosiderin is an iron pigment. Next question. Most commonly used cytological fixative. Option A, absolute alcohol. Option B, 95% ethyl alcohol. Option C, methanol. Option D, formalin. Right answer, option B, 95% ethyl alcohol. Next question. Special fixative for cytological preparation of sputum. Option A, Carnoy's fluid. Option B, Carbovax. Option C, Saccomano's fixative. Option D, ethanol. The right answer is option C, Saccomano's fixative. Special fixative for cytological preparation of sputum is Saccomano's fixative. Next question, the last question. Stain used for the identification of Barr body. Option A, Bayberry Scarlet Fast Green. Option B, Methyl Green. Option C, Shore Stain. Option D, Pap Stain. The right answer is option A, Bayberry Scarlet Fast Green. Stain used for the identification of barcode is Bayberry Scarlet Fast Green. So today we are winding up. You can watch the previous videos from playlist. And if you are watching without subscribing, please do subscribe the channel. Turn on bell button to get the notifications on time. Thank you.